Welcome to an in-depth exploration of botulinum toxin, a groundbreaking solution widely recognized for its efficacy in relaxing facial wrinkles and fine lines. Often simply referred to by its most famous brand name, Botox, this purified neurotoxin protein represents a cornerstone in aesthetic medicine. However, it's crucial to understand that Botox is just one of several trusted brands. Others include Dysport, Xeomin, and Jeuveau, each offering similar yet subtly distinct formulations and characteristics. At its core, botulinum toxin is strategically injected into specific facial muscles. Its primary role is to temporarily diminish the appearance of dynamic wrinkles, those lines that form as a result of our everyday facial expressions, such as smiling, frowning, or squinting. This treatment is celebrated for being minimally invasive, providing a highly effective way to achieve a smoother, more youthful complexion without the need for extensive surgery, making it a popular choice for individuals seeking refined aesthetic enhancements. Delving deeper into the science, botulinum toxin achieves its remarkable effects by specifically targeting and blocking nerve signals that are responsible for muscle contractions. When injected into a chosen muscle, the toxin interferes with the release of acetylcholine, a neurotransmitter that acts as the chemical messenger between nerves and muscles. By inhibiting this release, the muscle receives fewer signals to contract, leading to its temporary relaxation. It's important to distinguish between dynamic wrinkles, which are formed by muscle movement, and static wrinkles, which are present even when the face is at rest due to collagen loss and sun damage. Botulinum toxin is most effective on dynamic wrinkles, preventing the repetitive muscle actions that etch lines into the skin over time. Think of it like gently pressing the pause button on certain muscle movements, allowing the overlying skin to smooth out and recover, creating a more rested and youthful appearance. Botulinum toxin is strategically applied to address specific areas on the face where dynamic wrinkles are most prominent and contribute significantly to an aged or tired appearance. One of the most frequently treated zones involves the crow's feet, which are the fine lines that fan out from the outer corners of the eyes, often becoming more noticeable when we smile or squint. Another highly popular area is the forehead, where horizontal forehead lines develop from raising eyebrows, giving an appearance of surprise or worry. Equally common are the glabellar lines, famously known as frown lines, located between the eyebrows. These vertical lines are created by repeated furrowing of the brow, often conveying an impression of anger or stress. Beyond these primary areas, botulinum toxin can also be used for other, less common aesthetic enhancements, like softening bunny lines on the nose, lifting the corners of the mouth, or even relaxing platysmal bands in the neck for a smoother neck contour. The precision of treatment ensures a natural-looking result, preserving facial expression while reducing unwanted lines. Embarking on a botulinum toxin treatment journey begins with a crucial initial consultation with a licensed medical professional. This isn't just a formality. It's a vital step where you discuss your aesthetic goals, review your medical history, and understand the potential outcomes and any associated risks. The practitioner will assess your facial anatomy, muscle strength, and the specific dynamic wrinkles you wish to address. Once deemed a suitable candidate, the actual injection procedure is remarkably swift and straightforward. It typically involves a series of small, precise injections using a very fine needle into the targeted facial muscles. Patients often describe the sensation as a quick pinch or sting, which is generally well tolerated and discomfort is minimal. The entire process, from cleansing the skin to completing the injections, usually takes only 10 to 20 minutes, allowing patients to easily fit it into a busy schedule. Prior to your appointment, you may be advised to avoid blood-thinning medications or supplements to minimize the risk of bruising, ensuring the smoothest possible experience. After receiving botulinum toxin injections, patience is key, as the results do not appear instantaneously. While some individuals might notice a subtle change within 24 to 48 hours, the full desired effects typically begin to manifest more distinctly within 3 to 7 days following the treatment. This gradual onset allows for a natural progression towards a smoother, more refreshed appearance. The longevity of these effects is also an important consideration. Generally, the benefits of botulinum toxin last anywhere from 3 to 6 months. However, this duration can vary significantly from person to person. Factors such as individual metabolism, the specific strength and activity of the treated muscles, the dosage administered, and even lifestyle choices can all play a role in how long the results persist. For example, individuals with very expressive faces or a faster metabolism might find the effects wear off closer to the 3-month mark, while others may enjoy their smoother appearance for a full 6 months or even slightly longer. Regular maintenance treatments are usually recommended to sustain the desired aesthetic outcome over time. While the primary and most recognized use of botulinum toxin is undeniably the reduction of dynamic wrinkles, its benefits extend far beyond simply smoothing out existing lines. One significant advantage is its potential as a preventative measure. By relaxing the muscles responsible for repetitive facial movements, botulinum toxin can effectively deter the formation of new, deeper wrinkles over time. This makes it a popular choice for younger individuals looking to proactively maintain a youthful appearance. Furthermore, many patients report a significant boost in confidence and self-esteem as they achieve a more rejuvenated and refreshed look, often described as looking less tired or more approachable. The subtle enhancements allow for a natural aesthetic, avoiding an overdone appearance. It's also worth noting that botulinum toxin has extensive therapeutic applications. It is successfully used to treat chronic migraines, reduce excessive sweating, hyperhidrosis in areas like the underarms, and manage various muscle spasms or conditions like blepharospasm. These therapeutic uses underscore its versatility and established safety profile when administered by skilled professionals, highlighting its profound impact in both cosmetic and medical fields. Like any medical procedure, botulinum toxin injections come with safety considerations and potential side effects, although generally it is considered very safe when administered by qualified practitioners. The most common side effects are usually mild and temporary, resolving within a few days. These can include minor bruising, swelling, or redness at the injection sites, which are typically easy to conceal with makeup. In rare instances, more significant but still temporary side effects may occur, such as a slight drooping of the eyelid or eyebrow, known as ptosis, or facial asymmetry. These complications are often technique-dependent and highlight the absolute necessity of choosing an experienced injector. It's important to be aware of certain contraindications. Botulinum toxin is generally not recommended for individuals who are pregnant or breastfeeding, or those with certain neurological conditions that could be exacerbated by its effects. Always disclose your full medical history during your consultation to ensure the treatment is safe and appropriate for your specific circumstances. Understanding these aspects helps you make an informed decision and ensures the best possible outcome. The success and safety of your botulinum toxin treatment are profoundly influenced by the expertise of the professional administering it. It is absolutely paramount to seek out licensed medical professionals, such as board-certified dermatologists, plastic surgeons, or highly trained and certified aesthetic nurses. These individuals possess the in-depth anatomical knowledge, clinical experience, and aesthetic discernment required to perform injections safely and effectively, minimizing risks and achieving natural-looking results. During your consultation, don't hesitate to ask about their credentials, experience with botulinum toxin, and to see before and after photos of their previous patients. A reputable clinic will prioritize patient education, ensuring you fully understand the procedure, expected outcomes, and potential side effects. Furthermore, factors like clinic hygiene, patient reviews, and a clear, ethical approach to patient care should all be part of your evaluation. Choosing a practitioner you trust, who communicates openly and clearly, is the single most critical step in ensuring a positive experience and achieving your desired aesthetic goals responsibly and effectively.